Today we're going to be performing a cardiac assessment. You're going to begin by collecting the history of the patient. Do you smoke?
No.
Do you drink alcohol?
Nope.
Do you drink caffeine?
Nope.
Do you use prescription or recreational drugs?
No.
Do you exercise regularly?
Yes.
Do you eat a heart-healthy diet?
Yes.
Do you have chest pains?
No.
Any shortness of breath?
Nope.
Do you take any heart medications?
I do not.
Do you or anyone in your family have a history of heart disease?
No.
Once you've finished questioning them, you will perform a physical heart assessment. You'll have your patient sit at a 45-degree angle and you'll stand to their right. You're going to locate or inspect and palpate their 6 anatomical points of the heart, which are the aortic, which are located at the second intercostal. You find the angle of Lewis and go to the right. The pulmonic is to the left of the angle of Lewis. And then beneath that is the second pulmonic, which is at the third intercostal. Then the tricuspid, which is at the fourth or the fifth. The mitral, which is beneath that. And the epigastric, which is at the center at the bottom of the sternum. After you palpate those, which you shouldn't be feeling any pulse anywhere except the aortic and the mitral. After that, you will listen to each of those points for a full heart cycle for the lubbed up sound. And that is how you perform a heart assessment.
Okay, next we are going to do a circulatory assessment. We will start by taking the patient's blood pressure, which we can't do today because we don't have a blood pressure cuff. And we would also ask the patient's history, which we're just assuming we already did previously when we did before we did the heart assessment. We start off by, after we take out the blood pressure, which we are assuming was a good normal blood pressure today, we will palpate the internal carotid artery. Which you do one side at a time. Next, we will just take a quick listen to the carotid artery. We would listen for the sounds of bruit, which in this case we did not hear. Next, we will examine her jugular veins above her clavicle. And then we will examine the feet, fingers, hands, and toes. I said that out of order, but we would check for clubbing, signs of clubbing, cyanosis, which would be a blue tint to her fingers or toes. And we also would ask if she's in or experiencing any pain, tingling, or numbness. Are you experiencing any of those things?
I am not.
Perfect. Next, we will check her radial pulse, which we will do for a total time of 60 seconds. For this video, we're just going to do 30, but in real life, we would do 60. Okay, and I got a pulse of 80, which is within normal limits. Next, we would check the rest of her pulses. For the sake of time, we're not going to do that, but we would check her ulnar pulse, her brachial pulse, We already checked her carotid pulse. We would check her femoral pulse, her popliteal pulse behind the knee, her dorsalis pedis pulse, and her posterior tibial pulse, which in this case we're assuming are all within normal limits. We then examine her legs and feet. We will check for any varicosities in her legs. We will use our thumbs on her shins to check for peripheral edema. We will just hold down for a total of 3 seconds with our thumbs. And then we would gently touch her calves to check for any tenderness or swelling, which could be signs of phlebitis. And then we would finish by checking her superior and inferior inguinal nodes. And that concludes our assessment. Thank you.